The way, call Ken Do, 423-381-3427.
Hey, just before we talk with our friends from Direct Primary Care Associates, I use friends loosely, of course. Spring break contest, final day today, folks, is presented by Toyota of Cleveland. So here are the prizes today. This is it. 4 tickets to the Chattanooga Zoo, 6 tickets to Anna Keyston Gatlinburg, 6 tickets to the Tennessee Aquarium IMAX Theater, and thanks, Nathan Napier, $25 gift card to Little Caesars. Pizza. We'll have one winner at 5 o'clock. Mike Lee will announce the winner here on Mix 104.1, Mix Afternoon Drive. Also, this is week 3 of our top 5 at 5 with Freddy's, frozen custard, and steak burgers. Write down the top 5 songs that Mikey does at 5, Mike Lee, and call him and give them to him, and you could win a nice gift card or something from Freddy's.
Yeah, we have all sorts of prizes from Freddy's.
All right, so if you want to win the spring break giveaway, today's it. Today's the last day, presented by Toyota of Cleveland. Call or text in, call the volunteer, Red Pass Mix line, 423-614-6499. Text our Cleveland State Cougar line, same number. Now, folks, if you're texting, put your name on it. You will not win all of our text contests, and I will enforce that. And then, sadly, you'll be executed. And then, now, poor old Heather has never been in the studio. She is saying, what in the name of the Lord have I gotten into here?
She's not going to come back.
Yeah, and good for her. I'm not either. And then, what else? Text spring break. Which, by the way, Stacy, very excited. You want to give us your spring break plans? Stacy Flowers, Direct Primary Care Associates.
Well, I've taken the week off. I'm abandoning Heather and Dr. Coker. I'm going to stay home. And I was, putting my name down for some of those contests, Mix 104. I never win anything here. I think it's a complete conspiracy and sham.
Yeah, basically.
I don't really think that you ever give out any gifts. I think you just keep them for yourself.
I do. I'll be at, let's see, I don't even know where I'll be.
At the zoo?
Yeah.
As one of the...
Oh, is that right?
Yeah.
I was going to say...
He's not going to stay home for spring break.
I was going to say one of your relatives. But anyway. All right, well, let's get serious for a sec. First of all, introduce our guest here, our friend from DPCA.
Yeah, this is Heather Sharp. She's our PA. You've been with us how long now?
About 4 months.
This is nice.
5 months.
So she's not a new PA,
nice
but is
if you
new
meet
to
the
us.
staff. Good goodness.
I know. We had to get some new blood in there.
How long you been here? What's your name again? Good Lord. How embarrassing. This is National Employee Day, isn't it?
Employee Appreciation Day.
I told you.
No.
So she is accepting new patients, anyone but Steve Hartline. We don't want him in our office.
I don't know. Yeah, so Heather, good morning.
Good morning.
So Heather, so you're a PA there at DPCA. So what does that mean? Tell us what you do.
Correct. I'm a physician assistant. We do primary care, so we focus both on prevention and treatment of, acute illnesses like colds and flus and urinary tract infections, and also focus a lot on chronic disease management, helping people with their blood pressure or blood sugars and things like that.
So Heather, this has been a really, really tough year for flu and other illnesses. So you guys and talk to Brian and Stacy both. I mean, you guys have been very busy with that.
We have. And we're proud to do it. That's part of our care.
Stacy, also colorectal cancer. This is obviously an interesting situation to where people are being encouraged to get tested younger than used to.
Correct. So the initial screening age, for a lot of years was 50, and that has changed in the last few years to 45. So, we're capturing that a lot earlier. Seeing some of that, being able to be treated a lot sooner. And so that's part of what we do at Direct Primary Care Associates. Like Heather said, we focus on acute care a lot, taking care of people during cold and flu season, keeping that promise to our patients to get them in same or next day for those acute visit appointments. And that can be hard to do with your established primary care provider. A lot of times people are having to go to the ER or urgent care for those things because it can be hard to get in when an office has thousands and thousands of patients on their panel, and we really work hard to have enough providers in our clinic to keep those patient to provider ratios low enough that our providers are available same or next day to care for people who are established with them. And then we also provide that preventative care, like Heather said, for chronic illnesses, and then prevention. So at Direct Primary Care Associates, we really focus on nutrition, on staying healthy, on not only managing chronic illnesses, but getting to those root causes and prevention. And part of that prevention is colorectal cancer screening.
Yeah, so you guys can handle that, is that right?
So, yeah, we partner. We don't do it ourselves
Okay.
in the clinic, but we do partner with several area GI doctors,
Sure.
surgery centers, and we can get referrals to have those things done and manage as far as keeping up with when those are due, whether it be yearly, 3 years, 5 years, or 10 years.
All right, it's Direct Primary Care Associates. So there's a whole new thing we're doing here. This was Fretwell's idea. Morning, Brian Fretwell. And oh, by the way, Brian, congratulations. You came in for 2 weeks. That's 2 weeks longer than we thought. So I'm glad he made it that long. All right, so here we go. This is a brand new thing we're doing. It's 827 dpca.health. There you go. There you go. So the other website was too long for the deal.
Yeah,
Wow.
yeah.
You want to hear it again?
Absolutely.
dpca.health. I guess if I put a little more inflection in it, does that get your attention?
Yeah, a little bit more radio voice. You don't
Oh.
have enough of that.
Okay, hang on a second. Let me try it. Let me try it again. dpca.health.
There you go.
that
There you go.
better?
Yeah, yeah, absolutely.
Heather, anything you want to add here? Finally get somebody has some sort of sense. Hey, it's nice meeting you, though.
Nice meeting you as well.
All right, so how do people find out about you? So, Stacy, we're now using that on the air, dpca.health.
Do I have to growl into the microphone when I say it?
You're so angry, it's unbelievable. Are you really taking off and just staying home next week?
Yeah, I think I'm going to come in Friday. I'm going to come in Friday
Thank God I
because
won't be
Friday's a
here.
half day for us. So,
That's good.
you know, but
Well-
yeah, I'm gonna stay home, spend some time with the kid. I don't want her sitting at home alone.
She's wanting to go somewhere and get out of here. All right, guys. Hey, I would say it well. It is good to see you, and just keep up the good work.
As always.
Thank you.
Bye. See you. Heather, great meeting
Thank
you.
you.
Sorry about her. All right. Hey, what's your name again? How long you been here? My Lord, I mean, why don't you start meeting the staff? So, I mean, no, your mic's off.